Kirsten, hello.
Hello.
Looked at your daughter's X-ray and CT scan images. She suffers from craniosynostosis, as we suspected. Her images show that her suture is closed prematurely.
Okay.
Baby skulls have openings called sutures, which allow the brain to grow. The brain triples in size in the first year and continues to grow until they're about 12. Can you tell me a little bit more about your daughter's symptoms?
She cries all the time. I consulted 5 or 6 doctors, but no one really helped. They said I should let her cry, that I shouldn't spoil her, but I was sure something was wrong. She's in a lot of pain.
She has the condition craniosynostosis, but her skull shape is almost normal, so that probably made it more difficult to diagnose. Many doctors have difficulty detecting these cases, like your daughter's. Just to explain it to you a little more, as the brain is growing, it needs to be able to push the skull bones apart, giving it room to grow. If there is a fusion of a suture, then the growth is restricted and the brain is squeezed. Intracranial pressure can be extremely painful.
So what are the options?
We have to reduce the intracranial pressure, and we can only do that with surgery.
Surgery? That sounds really dangerous. My pediatrician said it could be fixed with a helmet.
If the sagittal suture hadn't fused, a molding helmet might work, but not now. Every surgery has risk, especially head surgeries, but your daughter is otherwise healthy, and that's a good thing, so that reduces the risk. We'll check to make sure that she doesn't have any heart or lung conditions which may get in the way of the procedure.
I'm just really concerned. What exactly will this surgery involve?
Well, there are two options. She's 6 months old, so we could go with a kind of minimally invasive procedure, or we can go with a traditional surgery. I'll explain the difference. With the traditional approach, we do an incision right above one of the ears. We go over the top of the skull to the other ear. It's the only scar that should form as a result. The hair usually hides it. Once the incision is made, the affected areas of the skull are removed. We create an opening for the brain to grow, and we reshape these bones and then return them to a normal position. And once we're finished, the incision is usually closed with dissolving sutures.
This sounds really difficult.
It's a big surgery, which can last up to 8 hours, and she'll be in the hospital for about 3 days after it. Craniosynostosis is a complex problem that requires the expertise of many different specialists working together.
If Jenny has this surgery, do we know she'll be without pain afterwards?
There's no guarantee that her condition will be gone completely. Some children continue to have some pain that we can treat with medication. Other children have situations where we may have to do another surgery, but it's very rare because the success rate's very high. We perform these surgeries successfully over 98% of the time. We've been doing it successfully for many years. So.
I'm sorry for so many questions. I just want the best choice for my daughter. After all the bad experiences, I want to be sure. So, what about the other procedure, the minimal one?
The minimally invasive endoscopic surgery is one that we normally perform when the baby is very young, usually younger than 6 months. We use an endoscope to open the suture. The procedure only takes about an hour. Afterwards, she only has to be in the hospital about a night. She can go home after that. After that, though, she needs to wear a correcting helmet for about 6 months. We have to check it every 3 months to make sure that the sutures haven't closed early. It's a simpler procedure. It can be successful much of the time, especially when the baby's very young.
Okay. Is the helmet painful?
No, it's not painful. The helmet is made custom made for her, so there won't be any pain. The success of the procedure is determined by how frequently she wears it.
This is all overwhelming. How do I decide what's best for Jenny?
Well, it's not easy.
So you're pretty sure she needs surgery? A helmet alone won't work?
She's had some fusion that has to be surgically corrected, and plus if you wait a month, then the minimal procedure won't be an option. She will be too old for that.
Okay. How do I get more information?
You should probably ask your pediatrician. Think about it for a few days. Let me give you a pamphlet that has information about craniosynostosis and surgical options.
Okay.
There you go.
Thank you.